digital platform that enables any allied health professional to work collaboratively to create, monitor and track custom therapy programs for kids. This is Max. Max has autism and ADHD. Did you know that 1 in 100 kids in Australia have been diagnosed with autism, and that every 30 minutes someone is diagnosed with a significant disability? And right now, the best method of treatment for Max is early intervention. So what does early intervention look like for Max? Max has this awesome team that surrounds him. He has a speech therapist, an occupational therapist and a psychologist. He also attends a supported school. Now the NDIA supports him with $20,000 worth of therapy resources every year. That's about 1 hour of therapy a week. Research suggests that he needs around 25 hours of therapy a week. That would cost the government around $500,000 per kid, and that's just not possible. And the ongoing effects of Max not getting enough early intervention are astronomical. He might not finish school, and he might not get a job. On the other hand, there's the clinician. 3 years ago, I was working full-time as a clinician, seeing 40 kids with significant challenges just like Max's every week. That's 8 kids a day, and if I saw them for 45 minutes, I'll let you do the maths on how much spare time I had. And outside of clinical sessions, clinicians have this huge medico-legal responsibility, along with liaising with other health professionals to make sure that we're working towards the same goals for Max. And then it didn't help that I read this research article that said the minute a patient leaves a medical practitioner, they forget up to 80% of what they've just been told. That's a huge amount of wasted information and wasted energy by health professionals who are just trying to help. And things that I found that worked really well for Max were phone reminders, checklists on his mum's phone, and liaising with other health professionals to find out what was working, and more importantly, what was not working. But the biggest problem with this is time. All these manual tasks take time. And the market's been crying out for a solution to this health problem. We have the e-health record, but there's not really an adapted space for allied healthcare workers. Clinicians create handouts and pamphlets, and they just create more admin for the therapists. And then there's parent-made digital solutions, but they rely on the parents teaching the therapists how to use the platforms, and there's huge compliance issues with this. And the technology doesn't need to be complicated. It needs to save me time, not create more admin. It needs to be highly interactive and fully customizable to meet the significant care needs of all the different people accessing allied healthcare. So why is this important? Home programming is a crucial part of early intervention, but we have a stressed and burnt out workforce. Did you know that 41% of paediatric clinicians burn out? And that there's 15 hours a week of unbillable admin time? That's about $140,000 every year per therapist. So that's why I created Theratrack, a way for my clients to take a digital version of me home with them. So how does it work? Theratrak is a dual-sided digital platform. We have a mobile app and a web platform that therapists can use in sessions to capture and digitize meaningful information from a therapy session and then track their clients' progress from a distance. We create virtual multidisciplinary teams that surround people living with a disability to live as independently as possible outside in the community. And for participants, they have easy access anywhere, anytime. They use our mobile app to get nudges and reminders about their early intervention practices, and so that they can stay connected with their therapist outside of their therapy session. Long term, we want to use Theratrak's dataset to create artificial intelligence algorithms to create predictive treatment strategies, improving the global access to clinical strategies and reducing the global economic burden of healthcare. Our go-to-market plan is simple, using direct sales referrals and partnerships. I believe that Theratrak is a platform that should be built by therapists for therapists. So if this isn't something that your organisation is interested in, please come reach out to me. We've got users here in Australia and in the US. We've got clinical partners across all states in Australia. And we've just recently signed our first large national enterprise customer, Everyday Independence. I've got an awesome team that surrounds me. Most of my teammates have been with me since the start, and they've all got significant experience in startup, business, and healthcare. We're looking to build our clinical advisory team. So if you're a speech therapist, psychologist, or physiotherapist, please reach out to us. I started this journey in 2018, entering into one of Australia's leading tech accelerators, She Starts. Since then, we've been building, iterating, and raising funds so that we can keep building Theratrak's platform to reach the wider audience here and abroad. I envisage a world where all kids like Max have the best chance at an independent future because they get the right amount of access to early intervention strategies that they need. Come join me.
Thanks so much, Laura, for that really great pitch. It was so interesting to hear about Theratrack, and particularly love little Max's story as well as a point of reference as well and a use case. So a few questions for you following your pitch. So first of all, who's your primary target market and who are your main customers for Theratrack?
Yeah, so our main customers are therapists and clinics and big, large enterprise customers like that. We see the most value that we're giving actually to therapists. Yes, the outward benefit is obviously that kids like Max get better outcomes and they don't come to therapy, but we're helping therapists save them time so that they can actually get on with their day a little bit easier.
Okay, great. So what's the take-up been so far and what sort of feedback have you gotten up to this point?
Yeah, it's been awesome. It's been really incredible. We started as a platform just for occupational therapists and pediatric occupational therapists. And over the last couple of years, we've moved into more of the multidisciplinary space because we had psychologists and speech therapists all crying out and saying, hey, we want this platform as well. So that's been amazing. Last year was crazy for us. We grew by 500% in the matter of 3 months, which was insane.
Wow, that's amazing.
So a little bit of a thank you to COVID for helping therapists go digital, but you know,
I think there's a lot of digital health businesses that are saying thank you very much to COVID today. So, you know, it's a good year for digital
that telehealth reimbursement code. I think everyone's really happy about that.
Yeah, definitely. Okay, so I guess one of the questions we commonly get asked and one thing that comes up regularly is about how new technologies work with existing technology. So, you know, how does your platform, how does Theratrack integrate with existing telehealth platforms and, you know, what are your plans with that going forward?
So that's actually something that we're working on at the moment. We're working on our first integration with a case management software system called Lumery. And then we're working on integrating that so that all the therapists can get their case notes across. As we sort of build and build into all those other systems, everybody sort of starts to talk to each other. So we're definitely looking at partnering with people like hopefully Coview, because they're here today, but other telehealth platforms as well, so that we can really streamline the process for therapists, so that they can set up their home programs, do their sessions, and everything is all encompassed all in one.
And seamless, and it doesn't feel like hard work using lots of different technologies.
Well, therapy shouldn't be hard work.
Absolutely. Well, some should be. Okay, just finally, what are you looking for now? Like, what? I know at the end you talked about how you're trying to build your team and things like that. So what's the next step in terms of what you're looking for? Partners, investment, what?
Yeah, so we're sort of in this big growth phase at the moment with Theratrack. So we're looking for more enterprise customers to join us to co-design the platform to see what works for them. We're also probably looking for some investment later in the year. So if there are industry partners, I'm looking for the right investors to jump on board with us, people that get it, people that understand the disability space, that understand why we're building what we're building. And then also we're looking for our clinical advisory team, like I mentioned. So we've got an awesome occupational therapist on our advisory team already, Leanne Healy from Everyday Independent. She's a whiz, she's amazing. But we're looking for speech therapists, psychologists and physios to join that so that we can have a more clinically evidence-based platform.
Sounds like a really exciting time to be part of the Theratrack team.
Yeah.
So, and thanks again so much for sharing a bit more detail with us here today, and look forward to seeing you at the event.
Thank you.
Thanks.